Have you been struggling with infertility? And you've been hearing terms like IVF, IUI, and timed intercourse. And you're confused. You don't know which one is right for you. Then this video is for you. Hi, welcome to Health and Wellness with Dr. Happiness. I am Dr. Happiness, your trusted guide in family health and wellness. In today's video, I will try to simplify the terms IVF, IUI, and timed intercourse so that at the end of the video, you'll be able to know which one is right for you. IVF means in vitro fertilization. It is fertilization that occurs outside the womb. IUI is intrauterine insemination. That is when sperm and eggs meet by the head of putting the sperm through the vagina into the uterus. There is no intercourse involved. And timed intercourse means when you time your intercourse to occur around your ovulation period. Now, those are the definitions. What are their differences? In IUI, intrauterine insemination, you are given medication in most cases. And when it's around your ovulation period, the sperm is introduced into the uterus through the vagina. You don't get to sleep with your husband. Now, IUI can be IUI by donor or IUI by your husband or partner. In a case where your husband is not able to produce enough sperms, a donor can be used. A donor sperm can be used to do the insemination. IUI is good where everything is okay in the woman. It is the man that has issue with sperm count or sperm quality. And then the sperm issue is a mild one, like when the sperm count is between 5 and 15. In IUI, the lady is usually younger than 35 years. Doesn't have any reproductive issue at all. IUI can also be used where infertility cannot be explained. Unexplained infertility, IUI can be used. Where the donor egg is used to do the insemination, it means both couples have agreed that the husband's sperm cannot be used due to low sperm count. Most times the donor might be known or not known. It could just be a volunteer. IUI is usually very simple. It is less expensive, but the success rate is less than IVF. In IVF, in vitro fertilization, fertilization occurs outside the uterus, in a petri dish, in a specialized lab. IVF is actually made for women with tubal factor, for women whose fallopian tubes are blocked. It is a procedure meant to overcome that cause of infertility. You know, it is in the fallopian tubes that fertilization occurs. It is where the egg and the sperm meet. And so if the tube is blocked, the egg and the sperm cannot meet. So to overcome this obstacle, that fertilization, that meeting of the sperm and the egg happens outside in the lab. So the egg is collected from the woman around the ovulation period, before ovulation occurs. And then the sperm is collected around the same time. And then fertilization is done by putting the egg and the sperm together and allow the fertilization to occur. So that is IVF. It is a more complicated, a more complex procedure. It is more expensive. It is usually done not only in women with tubal blockage, but in women that have tried IUI more than 3 times and did not succeed. Their option is IVF. Or in older women above 35-40 years, IVF is the procedure to go for. Or in men with severe low sperm counts, IVF is their option. With IVF, you have to take a decision. after the fertilization, embryo transfer is done on the 5th day. Remember, if you watch my previous video, I said the fertilized embryo during natural conception reaches the uterus on the 5th day. So the IVF tries to mimic what happens during natural fertilization, and the fertilized embryo is transferred into the uterus on the 5th day. Of course, the woman is given injections, hormonal injections, to keep her in that pregnancy mode like a natural pregnancy. Then what happens with the remaining embryo after fertilization becomes an ethical problem, becomes an ethical issue. Some couples find it difficult to say they should discard the embryo. If you are looking forward to having more children, it is the best thing to freeze the embryo, so that after the present pregnancy, next couple of years, you could go back and say, if you have decided to get pregnant, okay, I can use my embryo, instead of going through the whole process of fertilization all over again. So IVF, a more complex procedure, more expensive, it has a higher success rate. Then how about timed intercourse? For timed intercourse, the couple, they have no problem, but the problem is with knowing when the woman is ovulating. And so they are guided by their doctor, knowing their menstrual cycle, studying it, and then arriving at the day or around the day when ovulation is expected. At that period, the couple is advised to have intercourse. Sometimes there could be injections given to stimulate ovulation. In most cases, the women don't have any issue at all. The issue is with irregular cycle. There could be timed intercourse with ovulation induction. This is usually done for women with PCOS or irregular cycles, but they are younger. So there you have it. You have the 3 options. Either you choose the IVF or the IUI or the timed intercourse, depending on your diagnosis. Your diagnosis determines which option is right for you. And you don't get to know your diagnosis until you get tested. And that is why you have to go meet your physician on time. Don't delay. The earlier you go, the earlier you get your solution. If you want to understand more, you need to go and watch my previous video on female and male infertility. At this stage, if you have watched this video this far, I would like you to give it a thumbs up if you have found value. Share and subscribe so that you get to be notified when other videos come up. Share it with couples you think might benefit from it. Don't keep it to yourself. Remember, let's build healthier and happier families. I am Dr. Happiness.